Thank you all for joining us. I would like to introduce to you Dr. Reginald Eady, President and CEO of Trinity Health of New England, and Dr. Saeed Hussein, Chief Clinical Officer of Trinity Health of New England.
Good morning. Dr. Reggie Eady here, President and CEO of Trinity Health of New England. I'll just start by saying, wow, what a monumental day today is. Over the weekend, a lot happened, and you all know that the FDA approved the EAU with recommendations from their advisory committee, followed by CDC's ACIP, and then their approval of the emergency use of the Pfizer vaccine. And that's just the beginning, I think, of the great news. So as we move forward to vaccinate those that we were recommended to do so from the phase 1A category, we've got more good news, we think, coming as recently as this week on the 17th, when this process is repeated yet once again, but for a different company, Moderna. And then we think in the very near future, we'll have other manufacturers like AstraZeneca and Johnson & Johnson moving forward. So we are elated to be healthcare providers in such a great state like Connecticut. We're also happy to see that this is the dawning of a tomorrow we can get back to normalcy without masks, social distancing, and things of that nature. So I'm excited, and sure you are too. Dr. Hussein.
Thank you, Dr. Eady. Morning, everybody. Thank you for joining. This is Dr. Saeed Hussein, Chief Clinical Officer of Trinity Health of New England. This is a very exciting moment for us. We're prepared. It's actually a very historic week in our goal to crushing this pandemic. So at Trinity Health of New England, we've made extensive preparations over the last week or so in order to roll this vaccine out. Now, you all know that this vaccine is limited in supply. Healthcare systems across the country will be getting this vaccine on a weekly basis. So what we've done is prioritize our colleagues so that those on the front lines of taking care, for instance, of COVID-19 patients, whether it's in the ICU, it's in the ED, it's the med-surg units, it's some of our ambulatory clinics where we see COVID-19 positive patients, those colleagues and providers will be prioritized in sequence, and we'll go down from there to ultimately all colleagues at Trinity Health of New England.
Wonderful. All right, we would like to open it up to questions. So I can see the list of participants here. If you do have a question, I see some hands raised. So I will begin with Dominic Moody, NBC Connecticut. You may go ahead and unmute yourself and ask your questions.
Okay, thank you. I think one of my first questions that I have is when it comes to the amount of vaccines that you guys are prepared to get, do you have an idea of how many vaccines you guys are prepared to get or ready to get?
Yes, we expect delivery of our vaccine in the Connecticut hospitals tomorrow morning, and we'll be receiving close to 2,000 doses.
Okay. I'm not sure if there's a cap on how many questions I can ask, but I'll just keep going here. For their distribution efforts, I know that you guys will kind of help with some of the storage and getting the vaccines and so forth. So when it comes to that, can you give us just an idea of how many healthcare systems that you guys are holding or will be holding these vaccines for? And can you tell us who they are?
Yes, absolutely. So for instance, in tomorrow's shipment is also included the vaccine for Waterbury Hospital. We will also be supporting other hospitals such as Gaylord and Day Kimball.
Yeah, I think the important thing to know about that question and the answer that Dr. Hussein provided was that we have the ability, at least as relates to the Pfizer vaccine, to store several 100,000 doses, or vials, I should say. Remember, there are 5 doses in every vial. So we made sure that as an organization, we readied ourselves to ensure that because this is going to be a several-month process, we're doing our part as a healthcare region to make sure that we've got the adequate ultra-low storage for the Pfizer vaccines.
Dominique, did you have one more question, or are you all set?
Yes, ma'am. Just one more. When it comes to the nurses and doctors, when it comes to the distribution of those vaccines to some of those healthcare workers, can you tell me or walk me through just how that will work for them? Do you guys have them in a tier system of maybe this group gets it on one day and this group gets it on another day, just to kind of break it up and continue that social distancing that we all have been practicing?
Yeah, that's a great question. So not only are we tiering colleagues based on their exposure levels to COVID-19 patients, them taking care of COVID-19 patients, but we're also cohorting those colleagues and separating them so that they can select appointments on different vaccine clinic days. We obviously don't want the entire ICU out with mild symptoms related to vaccine administration. So we've taken that into consideration as well.
Thank you so much, Dominique. We'll ask you to put yourself back on mute. Excuse me. I'll take Tracy O'Shaughnessy from Republican American up next. Please unmute yourself.
I'm Tracy O'Shaughnessy. Can you hear me?
Yes, we can.
Thank you. I want to ask a couple of questions. First of all, did I hear you correct, Dr. Eady, that you are getting the vaccine tomorrow or that you have received the vaccine today?
Yeah, so a couple of hospitals have received the vaccine on today, but we anticipate sometime tomorrow morning receiving the couple of thousands of doses that Dr. Hussein alluded to earlier.
I just want to chime in to Dr. Eady's point that healthcare systems did not decide on how this rollout was going to take place. This is, from the federal level that healthcare systems are getting the vaccine shipment.
So it was the federal government that determined which hospitals were getting the shipment?
That's correct, Tracy. Good to see you.
Good to see you too, Dr. Hussein, in the flesh. I want to ask you two gentlemen, you talked about, Dr. Eady, that soon we are going to be seeing a tomorrow without masks, without social distancing. And yes, as I understand it, even though we will be having the vaccine distributed to more and more people as the months go on, people will still continue to have to wear masks and social distance. And I wonder if you could give me an idea of how, is that true, and for how long will that continue?
So that is very true. So, I think the easiest way we should look at this whole initiative is as a goal of herd immunity. So we want to get to, as quickly as possible, a day where we're comfortable that the majority of the people in our state, in our country, and on our planet have an immunity to this coronavirus. How long will that take is a question that we don't have the exact answer for. But just based on the information that we do have, we think that by the end of the summer or early fall, we as a state and certainly as a country should be looking herd immunity right in the face. Now, what percentage of the population has to be vaccinated in order for that to happen? Some say 70, some say 75, up to 80 and above. We don't know the answer to that at this point, but what we do know is that it is vital that the vast majority of people in our state and in our country roll their sleeves up and get vaccinated as quickly as possible, understanding that the rate limiting factor is the availability of the vaccine.
Last question. You mentioned, Dr. Hussein, an arrangement with Waterbury Hospital. I presume that has to do with you have storage capacity that you are kind of helping them out with. I wonder if you could explain that a little bit more, sir.
Yeah, happy to do so. So when we found out about the Pfizer vaccine requirements, we got into action and we acquired one of the largest ultra cold freezers in the state, which is able to hold 600,000 vials. Each vial can vaccinate up to 5 people. So that's pretty much all of Connecticut in terms of population, almost. So we're more than happy to assist other healthcare systems that may not have this technology.
And Waterbury Hospital is one of them?
I believe so.
Yes, and so just to make sure, you have space for 600,000 vials. Each vial contains enough vaccine to administer to 5 people each.
That's correct.
Yes, so that would more than cover the state of Connecticut.
Yes.
Okay, thank you, sir.
Thank you for your
Thanks,
questions, Tracy. We appreciate it. We're going to move on. If you could please mute yourself now, Tracy. We're going to move on to Channel 3, WFSB. I see your hand raised. You can go ahead and proceed. WFSB, we don't hear you. Okay, we'll open it up to anybody else that may have questions. Please feel free to unmute yourself and ask. Hi, Rich, I see from Hartford Patch, I see your hand raised. Go ahead and unmute yourself and ask your question.
Yes, I just want to know what's your protocol when if someone gets vaccinated and they do have like the mild symptoms from it, do they have to stay at work because of that, or what exactly is the protocol?
That's a great question. We're going to learn as we go. That's why we've cohorted our colleagues into various groups so that not all of them are out at the same time if they develop symptoms or side effects from vaccine administration. We will also be following CDC guidance and using VSafe to be able to report any side effects.
Yeah, I think an important thing to understand is that just based on Pfizer's research, usually the symptomatology presents itself in most cases after the second dose. But regardless of first or second, these symptoms don't last usually longer than 24 hours. So we don't think that there's anything that we have to, any reason why our colleagues, besides likely taking Motrin or Tylenol for the body aches, etc., should have to miss work. I mean, we're depending upon the men and women that come to work every single day at Trinity Health to continue to drive our mission so we can reach our vision, and more importantly, during this pandemic, to meet the needs of the community. So that is not a big concern of ours. We're more concerned about how much and when the vaccine will come in, and how many people will be ready and able to receive the vaccine at its availability.
Thank you, Rich. And I see WFSB, you're having some microphone difficulties. You can send me your question and I'm happy to ask that. If anybody else has a question they would like to ask, please feel free to raise your hand on the top toolbar and we'll be happy to take your question. Channel 8, please feel free to unmute yourself and ask.
Hi there, doctors. I just wanted to find out, as far as the doses that will initially come in, have enough to...
Tina, is that Tina? I'm sorry, I'm going to interrupt you, Tina. We're having a little bit of trouble hearing you. Could you speak up?
Sure, sorry about that. Can you hear me now? A little better?
A little bit, but go ahead.
Okay, so the 2,000 doses, is that enough as far as the staffing goes? I know you're trying to, as far as being able to get all frontline workers vaccinated, or will you need more for that first dose as well?
Tina, I do apologize. We're having trouble hearing the first half of your question. If you want to go ahead and text me, I'm happy to ask that to our folks. Any other outlets that are able to ask a question through here, please feel free to raise your hand and we're happy to take those. All right, I see Tina's question from Channel 8 has come in. Her question is the 2,000 doses enough to cover all of the frontline workers at the hospital? Or will there be a need for more vaccines to get that first round complete? If you could speak to that, please.
So this will just be tier 1 out of our phase 1A. We will require, and we are receiving additional shipments every week. And we anticipate that by the end of the month, early January, we would have had enough vaccine to vaccinate all of our healthcare colleagues.
Thank you, Dr. Hussein. We may have a follow-up, so we'll hang tight for just one moment. And a follow-up question to that is, what is the timeline between the first dose and the second dose, which would be needed later on? If you could speak maybe to both vaccines, that would be helpful.
So it's 3 weeks for Pfizer and 4 weeks for Moderna.
And then, because this is going to be a topic in the very near future, if we are so fortunate as a state, AstraZeneca is 30 days for the second, and then Johnson & Johnson, which is also interesting and exciting, they have experimented thus far with a one administration or just one dose, and now they're looking at and comparing having 2 doses. So just keep that in mind. They don't know, have not suggested the number of days between the two if Johnson & Johnson, in fact, has to go with the two.
Thank you, gentlemen. And I'm moving to channel 3. I received your question. Thank you. She says, I want to know how long it will take to give out 2,000 doses. Who will be the first? And how much more will you need to vaccinate all your hospitals?
So we have about 11,000 colleagues and 3,000 odd providers. And this does not include independent providers that fall in the catchment area as defined by the Department of Public Health in Connecticut. So in order to get to that level, as you can imagine, we would require several more weeks of vaccine shipments from Pfizer and Moderna.
And I think it's important to also add to that we're vaccinating more than just the Trinity Health of New England frontline staff. We ultimately, as a vaccinator, are also responsible for those providers out in the community that don't necessarily have an affiliation with Trinity Health of New England or other healthcare systems, and their staff within their office, because they too are interacting with the COVID positive citizens from the state of Connecticut. So point is, we will extend beyond the colleagues within our organization.
Thank you. And I would like to point out Fox 61. I saw that you joined us just a few moments ago. We have been speaking about the timeline and distribution of the vaccine here for Trinity Health of New England. So if you would like to ask any questions, please feel free to unmute yourself at this time and ask our guests the questions. We have Dr. Reginald Eady, President and CEO of Trinity Health of New England, and Dr. Saeed Hussain, Chief Clinical Officer here at Trinity Health of New England, as your guests today.
Dr. Hussain? Dr. Hussain, can you hear me?
Yes?
Yes, Tracy.
Oh, fine. I always have more questions, as you know, Dr. Hussain. I want to ask, the one thing that has been reported is that people who have severe allergies, particularly to bee stings, may have an adverse reaction. What are your thoughts about that?
So as per guidance from the CDC ACIP, those individuals will require observation period of 30 minutes as opposed to 15 minutes, but they are encouraged to get vaccinated as well. There's only one contraindication coming in, and that the contraindication from the CDC has to do with anybody who has who's had a severe allergic reaction, i.e. anaphylaxis, to an ingredient in the current Pfizer COVID-19 vaccine. And one of the ingredients is polyethylene glycol, which is a lipid, which is used in some other infusions. So if there's any kind of previous history of a severe allergic reaction, that might be a contraindication, but that's the only one.
So those would be people who have severe allergies to anything, not just bees in particular.
Absolutely.
Okay. Sir, how do you see, and I ask both of you gentlemen, if you can peer into the future, we are seeing the drip, drip, drip of vaccines come online. At the same time, we are seeing an acceleration of cases and deaths, and with the holidays coming, I don't even want to think what that will be. How do you see this race, as it were, between these two sort of forces taking shape in the next few months as we go into 2021?
Yeah, so a couple of things. One, what we know is that the activity that took place around Halloween was the beginning of the increase in infectivity and hospitalization. And as you suggested, then came Thanksgiving. So we're now seeing a number of people being infected through the positive test, and we're now seeing an increase, as you know, in our state in terms of hospitalizations. Well, then there's Hanukkah celebrations, there's Christmas celebrations, there's Kwanzaa celebrations, the New Year's Eve celebration, and then the Three Kings Day celebration. So all of those will suggest that people will be gathering, and with that we expect to see a compounding of positive tests as well as hospitalizations. And this is really the crux of the matter. This is the urgency or emergency or the challenges that the hospitals will be faced with, because now there's a capacity question that we've got to answer. There's a staffing question that we have to answer as well. The way to look at this is things will happen in reverse now that we have the vaccine. It is my opinion that just as we saw the coronavirus present itself, then we had the growing number of infections, growing number of hospitalizations, and then growing a number of deaths. As the vaccine is administered across our state, the reverse should happen. We should see first a decline in death, then a decline in hospitalizations, then we should see the infectivity rate go down, and then we will get to several months from now, but sooner than later, depending upon compliance and again the availability of the vaccine, a day we can go back to not social distancing and taking our masks off.
So Tracy, I want to chime in. It is critically important that our residents in this region realize that physical distancing, avoiding gatherings, masking, as well as practicing hand hygiene will be critically important in the weeks and several months to come. This vaccine, until we get to the herd immunity phase, we will still continue to see cases and hospitalization and deaths. So per IHME, if folks don't stick to all these public health measures, we may even, worst case scenario, see a doubling in the mortality rate by April.
Well, could you tell me more about that? If folks don't stick to these measures, a doubling of mortality rate by April. Could you say a little more about that?
Yeah, that is modeling done by IHME, which the White House Task Force uses as well. It's a projection, but it takes into account the percentage of masking, physical distancing, and all the public health guidance that we know about. So it's critically important folks continue to do that while getting vaccinated.
Last question, I promise. Dr. Eady, you mentioned some promising vaccines still in development and some interesting information about Johnson & Johnson, which I hadn't seen before. We haven't talked, however, about whether there's any hope on the treatment side. I know that you have a few extra techniques or therapies that you can use to help patients who are already sick. Do you see anything coming up on the horizon that will give you more in your toolbox to assist patients already infected?
I can't think of anything offhand. I wonder if Dr. Saeed does, but to the point you're making, I mean, if you rewind back to March and compare it to the therapies that and the intel that we have as scientists and providers today, I mean, it's a vast difference, right? So we have things, thank goodness, like the monoclonal antibodies, the remdesivir, etc. I mean, we are much smarter at having the ability to more aggressively care for people who have been inflicted by the COVID disease. And we also have the ability to, in parallel, treat or provide non-COVID care, if you will, within our healthcare systems, which makes all the difference in the world. Because when you think back to the number of people that stayed home under the advice of multiple physicians, healthcare experts, etc., during the first wave of the pandemic, I mean, their outcomes were not acceptable, and they had untoward impact from staying at home. Well, today at Trinity Health in New England, we're proud that we're inviting people to come in, and the moment you come in our triage, we then separate our COVID care from our non-COVID care, which is the right thing to do. We didn't know what we didn't know in the past, but now that we know what we know, we have what we have in terms of therapy and support, we're in a much better position to save lives.
Okay. Thank you, sir.
Tracy, thank you so much for all your questions. I am going to move us on as we're getting close to the end of our time here. Channel 8 has one follow-up question, gentlemen, and Tina, I will try and do this justice. Since in the 3 weeks, some will still need to get their first dose, will some get their second doses before others get their first dose? What is the protocol for that?
Yeah, so we're going to have to do them simultaneously, right? So let's think about this just quickly. So we're getting a dose, 2,000 tomorrow. Our intent is to administer them as quickly as possible. The following week, we believe that we'll have more Pfizer and then for the first time, Moderna. So the second week, because the second shot is on the third week, the second week we will be giving more first shots of Pfizer and then first shots of Moderna. And then the third week we will be doing the same. And then the following week we need to start giving the second dosage for the people who received it in the first week. And then we will be shortly after, a week later, we will be giving the second dose of Moderna. So we have to, which makes this very complex, in addition to the storage of the vaccines, we have to make sure that the proverbial Mrs. Jones gets her first and second shot from the Pfizer batch, or Mr. Jones first and second from the Moderna batch. We cannot contaminate the strategies. And this is what or Saeed and his team, I should say, have been working diligently at in preparation for the arrival of the vaccine. So we're ready and able to do just that.
Thank you both. And we have another follow-up question from Channel 3. And you may have just covered this a short time ago, but just for clarity purposes, can you please tell us how long the vaccine will keep people from getting sick? So any information on how long the vaccine is effective?
So we don't have a clear answer yet. The long-term implications of what this vaccine portends will come more from the manufacturer, but for now we do know it does give immunity for an 8-week period for which the trial participants were studied.
Perfect. So gentlemen, we have a few more minutes. Again, Fact 61, I did see that you came in a touch late, so if there are any questions that you did not have answered, please feel free to ask those now. And I will ask that we do one final recap on the timing and distribution of our COVID-19 vaccine to our colleagues, if that's okay, gentlemen.
Sure. Want to take that?
Sure. So we expect our first shipment of Pfizer vaccine for Connecticut hospitals at Trinity Health of New England tomorrow morning, and we will start vaccinating as soon as the vaccine is available from tomorrow afternoon.
Any final words?
You know, I think it's just important that and I think Dr. Saeed Hussein alluded to this, even though the vaccine is here, which is something that we should all be elated about, there's still the vaccine hesitancy that exists throughout the state. So we need to address those. It's usually greater in communities of color, but that's all of our responsibility to ensure that we get the information to the potential vaccinatee, everything he or she needs to know so that we can reduce anxiety, address their concerns, and push us toward herd immunity. But until then, we have to continue to mask, we have to continue to separate ourselves, and we must maintain the appropriate hygiene until we reach our target, which is the herd immunity in the state of Connecticut.
That's a critical point that Dr. Edie just mentioned. I just want to reiterate that we've started our own internal colleague webinars to educate and be available to answer any questions that colleagues may have. We're also going to be doing the same thing for the community, and we're partnering with Yale and Nuvance for the same thing as well. And we would love to partner with the media as we go forward, because you have a very important role to play in terms of educating our communities and also being able to answer their questions and hesitancy around this vaccine so we can all crush this pandemic.
Well, we thank you all very much for the time today and for joining us. We will be doing this again tomorrow, as you saw in the media advisory, and we'll be doing this Wednesday and Thursday as well. So please let me know if there are any technical difficulties, and I'm happy to work through those with you. And you are welcome to send your questions in advance, and I'm happy to read those for you. Again, thank you all for your support, partnership, and for joining today.